Good day. Welcome to today's COVID-19 update with the Honorable Minister of Health, Dr. Frank Anthony. Minister Anthony, again, thank you for joining us.
Well, thank you very much for having me in your program.
All right, let's get straight into it. Let's talk about the ventilators, get that out of the way. We know that you began the process of sending them to the different regions.
So, first of all, we have now about 35 or so ventilators that we bought in. And these were through a grant that we got from the Indian government and also through PAHO. And we have assigned a number of ventilators to the Georgetown Public Hospital. In fact, we have given them an additional 9 ventilators. So every ICU bed now that they have a ventilator for every bed at the Georgetown Hospital. In addition to that, we have kept some for the new facility that we are doing, the ICU at the Ocean View facility. As you would recall, we have already started installing the gas lines. The contractor is awaiting some special parts that they have already ordered, and we are hopeful that sometime during this week they'll receive those special pieces of equipment so that we can put that system in place. In anticipation that we'll have that up and running, we have already allocated a number of ventilators to that facility. At the regional level, our plan is to build capacity in the region, and therefore we have started distributing ventilators to the region. In Region 6, we have given them 2. Region 1, they have 1, but it's not working, and we have allocated another one that should be going up shortly to Region 1. Region 2 they have already collected their ventilator, and I'm hopeful that they'll set it up shortly. Similarly with Region 3, they have, if they haven't collected it as yet, but one has been allocated to Region 3. So all the hospitals, the regional hospitals, basically, we have allocated at least 1 ventilator to them. And some have already collected, others are yet to collect and take it up into the region. Now, while we were waiting on these ventilators to come in, we had started training doctors on the use and how to use the ventilators, which is extremely important. So they've got to familiarize themselves with what to do and how to do it. And later this week, because now we have so many ventilators at different levels of our system, we want to ensure that we standardize the guidelines for the use of ventilators. So later this week, the clinical committee that I've established, they'll do 2 things. One, they're updating the treatment guidelines for COVID-19 in Guyana. And secondly, as part of those treatment guidelines, to put out specific guidelines on when to put a patient on the ventilator, what are the measures that you'll be using to put that patient on the ventilator, and so that anyone across the country, once they follow these guidelines, they will know when somebody would need to go on the ventilator. So this would be standardized guidelines, and everybody who would be treating COVID-19 patients would be trained on these guidelines. So as we roll out ventilators, we're also rolling out basically the instructions on how to utilize the ventilators, the clinical instructions, and what to follow, how to examine the patient, what to look for, and then when to put the patient on the ventilator. So I think the capacity at the regional level would improve with these ventilators being there. So if somebody needs urgent attention, then they will have ventilators in place to provide that respiratory support. If they need additional guidance, or if that patient needs to be evacuated and come to Georgetown Hospital, then we have a process in place where we can evacuate that patient from whichever regional hospital to the Georgetown Hospital. So I think we have worked out those arrangements, and we'll put them to use as the incidents occur.
All right. Initially, I was going to ask you about an update for the Ocean View facility, but you've already indicated what is happening in terms of patients. How many do we have right now at the hospital?
Right now, we have about 20-something patients that are more mild patients. They're isolated, so basically every patient they have their own room, and they're there for the duration of the infection. If, however, a patient who is housed at Ocean View, if they deteriorate or they start having what we call respiratory distress, meaning they're having difficulty with breathing. If that occurs, then they are assessed by the team of doctors who are there, and they would then be taken to Georgetown Hospital, where we have other types of equipment that can provide respiratory support. We are hoping that once we complete the ICU section of the hospital, that we will then be able to provide a continuum of services. So you don't have to move from there. So if if you're a mild case and then you deteriorate and you need respiratory support, that respiratory support would be on site for that patient. So that's what we're trying to do. But it would take a little bit more time because, as I said before, we are waiting on the equipment to come in so that we can connect the lines that were run there.
Right. If I can, I know it's not this ICU only, there's several. I noted that when you went to Region 6, it was the same thing. So it's a project that is across board.
Right. So what we want to do is to improve the ICU capacity. And we also want to have in every regional hospital a designated area for COVID-19 patients. So basically we are assigning X amount of beds for COVID-19 patients, and that's because we want to do two things. We still want our hospitals to operate, and so regular patients coming in for service, they must be able to get that service. But if there's a patient that came in because they're COVID positive, they need care, and we should be able to provide that care in a specialized unit, so to speak, without that unit disrupting the other services of the hospital. That is why we have put in the types of triage, where patients come in, they're being screened, and then if they're positive, they will go to that special unit that we have created. So we're trying to build the capacity in every regional hospital. And if persons are in there, some of them might not need respiratory support, and they would go through the duration of the illness and then be discharged. But some of them might get a little bit more complicated, and they would require respiratory support. And if they do require that respiratory support, then we want to ensure that we have the ventilators in place to provide that. And that's why we are working to put ventilators at the regional hospital. As it is now, well, a couple of weeks ago, we did not have any ventilators at these regional hospitals. So basically what happened, if somebody required that support, they had to be sent to Georgetown Hospital where they will be managed. But now we are trying to decentralize some of this facility so that at our regional hospital we are able to provide a higher level of care.
All right. Before I ask you to address the long-term effects of COVID-19 and what specifically the government plans on doing, let's talk about mental health. I know yesterday, actually the course is beginning today, but yesterday was the launch, and that is major for the health sector because most of the frontline workers are being trained to deal with mental issues, especially within the pandemic. So I noted that you said specifically yesterday that there aren't many qualified persons to diagnose mental illness in Guyana.
Well, a lot of our doctors, let's say, while we would do a course on mental health during training, a lot of them do not take that up in any serious way, so they will probably specialize in other areas. But mental health is a growing problem, not just in Guyana, but around the world. And one of the biggest problems that the WHO have identified is that there are many people who present at our primary care level and they're not being detected because the primary care doctors don't pay attention to these risk factors for mental health. That's one of the reasons why, for example, people who are very depressed, if the primary health care physician does not ask certain questions, does not detect depression, that person can then remain undiagnosed for quite a while. And so one of the things that we are trying to do is to equip primary care physicians and nurses and other healthcare workers with more knowledge so that they can make these diagnoses. They can pay attention to some of these things and be able to help their patients in a more holistic way. And so that's what this training is about. Now, what has happened since COVID is that a lot of people are at home. Some people have lost their jobs, so there's a lot of anxiety. A lot of children are at home because schools are not working and they're closed. And so the parents who are at home, sometimes they have this additional tension in dealing with children and all of that at home. And so people's coping mechanisms are sometimes being challenged and they feel frustrated, they're not able to manage. And so we want to provide an outlet. So if people have these challenges in their life and they need an outlet to talk to someone, an outlet where they can interface maybe with a health personnel, then we should be able to provide that. So part of this training is to help our healthcare workers to expand their repertoire of services that they're offering, especially in the area of mental health. Counseling is another specialized service. Not everybody can do counseling, and we need to work with people, understand their difficulties, understanding their life challenges, and then help to come up with coping strategies to get them out of these challenges that they have. So that's another area that this course has been focusing on, and hopefully at the end of it, our healthcare workers would be better equipped to do that. In addition to all those categories of persons, during the pandemic, what we have noticed, and again this is a global phenomena, is what they're terming now infodemic. That's a flood of information. So just like how you have pandemic, which is across the world, they're now saying this flood of information is also overwhelming people. So when people turn on their televisions and all they're hearing is about COVID and the fear and all of that, two things can happen. One is that people will become very fearful and want to, and become very anxious. Or sometimes people just become numb. And in a sense, they stop reacting to all this bad news. And that can be bad because then they feel they shouldn't be compliant and things like that. So we have to look at how the information that people are receiving, how it affects people's behavior. And so with this infodemic, we have noticed that because of the internet and the speed with which information spread on the internet, if somebody put a wrong, wrong messages out there, that spreads as well. And then to try to correct that, to try to correct these myths that have been generated, takes a lot of time, and sometimes we are not even able to undo the damage that was done by misinformation. So we have to constantly guard against that so that we don't create too much tension in the society, too much anxiety, too much fear. And that's another thing that we're trying to get over during this particular course. How do we address some of these issues? And how do we get people oriented so that they can get the right types of information and utilize that information to modify their behavior so that they can, you know, work with us in defeating the pandemic. Of course, while we look at the public that we are serving, we also have to look at our healthcare workers. You know, healthcare workers would get burnout as well because they are at this, you know, constantly. And so they too would need to figure out, and we have to come up with ways and means of how we can address some of the issues with our healthcare workers, put systems in place to be able to address their health concerns as well. And so part of this course would also address that. The stigmatization, that's a big thing. When you have diseases, people tend to associate, you know, certain persons with this disease. We have seen that with HIV. It took us a long time for us to get past that, and even up to today, there's still some stigma and discrimination that is still attached to that. We have seen at the beginning of this pandemic, there were issues with stigma that arose. So if, for example, we had the case with the minibus drivers not wanting to pick up nurses because they just see somebody in uniform and they assume that because you're in uniform, that you're probably working with COVID patients and therefore they don't want you in their buses. That's a real erroneous approach. And so I think we have been able through public education to dispel some of those myths. Nevertheless, because of the situation that had confronted our nurses, one of the mechanisms that we have put in place, and because of the curfews and so forth, we had to put in place transportation to take nurses home and other categories of health workers home and so forth. But these are the kinds of issues that we want to address in the course. It's not going to be the last course that we'll do. We'll certainly do other courses, and we want to ensure as much healthcare workers are trained during these sessions. A good thing is that in Guyana, for doctors to become registered every year, you have to get 12 continuous medical education credits. And this particular course, if doctors are enrolled on it and finish the complete course, then they will get 8 CME credits. So it is worth your while to also participate because you're being rewarded with credits. The ministry is going to continue to do a lot of training, and we're trying to move on to the virtual platform. As I said before, at the end of this week, we are hoping to have updated clinical guidelines, and those guidelines dealing with the use of ventilators. And once those guidelines are completed, we'll do another round of training for our clinicians to ensure that they understand the new guidelines, the new medication that we're using and how to use them, the dosages, and so forth.
Okay. As we mentioned just now, long COVID. Could you explain to me what exactly is that?
Well, this is something that is emerging now. When someone gets infected, basically after the course of the infection, you would recover, right? And most people would recover rapidly. That's with most diseases. But what we are finding with COVID, it doesn't only pose a danger during when you're hospitalized, but when you're discharged from hospital, for some categories of patients, although they're discharged, they're non-infectious now, so they're not a threat to the general public. But many of the effects of the disease would linger with them for another maybe 3 months and even longer. What some of the kinds of things that we're seeing with some of these patients is that they continue to have like muscle aches. Some of them would be constantly fatigued. Some of them would have respiratory distress. They'll continue to have breathing problems. In some cases, it has been documented that people would have problems with their heart, and those heart problems mimic what you call heart attack or myocardial infarctions. Persons would have irregular heartbeats. So basically, long COVID occurs after you would have been discharged from hospital, but you're still having a lot of other complaints. And this is something that, you know, people have to guard against. We don't know the prevalence of long COVID. We don't know how many people are affected by it. It's a new thing that we're observing. And we have a lot more to learn about it and what treatment strategies we would employ. But it's something that our clinicians here would have to keep an eye on. And it's not just heart and those general things that I've mentioned, but almost every organ that can be affected by COVID, whether it's your brain, whether it's your gut, whether it's your kidney, whether it's your liver. All these areas are targeted by the COVID virus when you're infected, and therefore when you recover, potentially some of these organs can still be affected. But it's something that I guess our clinicians will have to research and look into more and come up with strategies if we identify such patients in Guyana, how we're going to deal with them.
All right, and is there anything specifically in place in terms of, I know we still monitor patients when they go home, but is there anything else or that is being done?
Well, if anyone has these challenges, I would imagine that they would be speaking with their physicians and they would be coming back for regular visits. And in those monitoring visits, some of these things can be detected. In other cases, it is important that for younger people especially, because a lot of these signs and symptoms were with people who had mild COVID, so actually in some cases they were never even hospitalized. And then 3 months after, in cases of some of these heart attacks, they noticed that younger people were coming into the hospitals with typical signs and symptoms of heart disease, and which is really atypical for young persons. So it's not the norm for a young person to come in with those signs and symptoms. And that arose some suspicion. And when they go back into the history, they notice that these persons actually had a mild form of COVID. So it is something that we would have to monitor. And if we are seeing younger patients coming back to the hospital with signs and symptoms relating to maybe heart disease and so forth, we might want to interrogate to see whether they had a clinical history of COVID. As I said, this is relatively new and we are learning more about this disease. And this is just another area that has surfaced. And we'll have to put more efforts in learning and investigating what is happening with long COVID.
Okay. Minister Anthony, thank you so much.
Well, thank you very much.
That's it for today's COVID-19 update with the Honorable Minister of Health, Dr. Frank Anthony. Remember, for more information, you can log on to our website, dpi.gov.gy, and the Ministry of Health's website as well, health.gov.gy, and our social media platforms. Thank you.